Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Imagine cutting down weeks, literally weeks, of daily medical treatments to just say 5 sessions, and doing that without losing effectiveness or messing with your quality of life.
It sounds almost too good to be true, but for men needing radiation after prostate surgery, it's looking increasingly possible.
Yeah, that's what we're diving into today. There's this really interesting study looking at a much shorter course of radiation therapy after a radical prostatectomy. That's when the prostate gland is surgically removed.
Right, and this shorter course has a specific name, Stereotactic Body Radiotherapy. It's quite a mouthful.
It is. But if you're keeping tabs on, the latest in cancer treatments, especially options that might be less of a burden, this research is definitely something to pay attention to.
Absolutely. We're going to unpack what this approach involves, how it stacks up against the standard treatment, and look at the potential benefits and, importantly, any limitations.
And we're drawing our info from a couple of places, a health news article that flagged the study, and crucially, the original research paper itself, published in JAMA Oncology.
That's right, getting into the details.
So our mission today really is to understand, is this shorter radiation therapy a genuinely good, safe alternative for men after their surgery? And what could this mean for treating prostate cancer down the line?
Okay, so let's set the stage first. Why is radiation even needed sometimes after the prostate's been removed?
Good question. Even with successful surgery, there's always a risk that some microscopic cancer cells might have been left behind in that area.
Exactly. And radiation therapy is used to target and hopefully eliminate those remaining cells, reducing the chance that cancer might come back later.
But the standard way of doing this, it's a big ask, isn't it?
It really is. We're talking daily trips to a treatment center, often for, 6 to 8 weeks. It's a major time commitment.
You can totally see why someone might think twice about signing up for that, even if it's recommended.
Absolutely. Which brings us to this alternative, stereotactic body radiotherapy, or maybe we can call it SBRT for short now.
Okay, SBRT. Let's go with that. So what makes SBRT different?
Well, the core idea is delivering radiation differently. It uses very precise beams to deliver higher doses of radiation per session, but to a very targeted area.
Higher doses, fewer sessions.
Precisely. And in the study we're looking at, the entire treatment course was completed in just 5 sessions.
5 sessions versus potentially 30 or 40. That's a huge difference.
It is. And SBRT isn't entirely new. It's already used sometimes for prostate cancer before surgery or for cancer that hasn't spread.
Ah, okay. So the question here was specifically about using it after surgery.
Yes, that was the focus. Because after surgery, the anatomy changes slightly. The spot where the prostate was, the prostate bed, and the nearby organs like the bladder and rectum can move around a bit from day to day.
Which makes that high-precision targeting a bit trickier.
Potentially, yes.
Yeah.
You need to be really confident you're hitting the right spot and avoiding healthy tissue, especially with those higher doses per session.
So how did they address that?
Well, technology's improved a lot. Things like MRI-guided radiation therapy, which gives much clearer real-time images during treatment, allow for better tracking of the target area and adjustments on the fly.
Okay, that makes sense. Better imaging, more confidence in using this SBRT approach after surgery.
Exactly. And that leads us to the trial itself. It's called the CIMITAR trial.
CIMITAR, got it. What was the setup for this trial?
So it was what's called a phase 2 trial. The main goal of a phase 2 is usually to check if a treatment is safe and feasible, kind of a first step before larger, more definitive studies.
It wasn't randomized, you mentioned.
Correct. It was non-randomized. They enrolled 100 men who had undergone radical prostatectomy and then received this 5-session SBRT. They followed these men for just over 2 years on average.
And who were they compared against?
For comparison, they looked back at the records of a separate group of 200 men who had received the standard, longer course of conventional radiation therapy after their surgery.
Okay. And what were the researchers measuring? What were the key things they looked for?
The main focus was on side effects, specifically patient-reported outcomes. They asked patients directly about their urinary function, their bowel function, and also their sexual health. These are the areas most likely to be affected by radiation in that region.
Right, makes sense. So what did they find? Did the shorter, high-dose SBRT cause more problems?
Well, this is the really interesting part. Overall, the study found that SBRT did not cause significantly more side effects than the standard longer treatment.
Really? Even with the higher doses per session?
Apparently so. Based on this data, let's look at the specifics. For urinary issues, about 25% of the SBRT guys reported moderate problems, and 4% had severe symptoms.
And how did that compare to the standard group?
Very similar numbers, actually. No statistically significant difference there.
Okay. What about bowel problems? Sometimes radiation can affect the rectum.
Yeah, they looked at that too. In the SBRT group, only 3% had moderate bowel issues, and another 3% reported severe symptoms.
And compared to the standard treatment?
Again, very consistent. The rates were comparable between the SBRT and the conventional radiation groups.
Wow. So similar side effect profiles for urinary and bowel function. That's quite something.
It is. And it wasn't just about specific side effects. They also asked patients about their overall quality of life.
And any difference there?
Nope. The study reported no significant differences in patient-reported quality of life between the two groups, even looking out to the 2-year mark.
That seems like a really important finding. Same quality of life, potentially same side effects, but much, much less time spent in treatment.
Exactly. That's the potential big win here.
You mentioned MRI guidance earlier. Did that play a specific role within the SBRT group?
Yes, it did. They actually found that patients who received SBRT with MRI guidance seemed to have even fewer gastrointestinal side effects and fewer late urinary problems compared to those who had SBRT without it.
Interesting. Why would that be?
The thinking is that the MRI guidance allows for even greater precision. Because they can see things so clearly and track movement, they could use tighter planning margins.
Margins, like a safety border around the target.
Exactly, a buffer zone. With MRI guidance, they felt confident using a 3-millimeter margin, whereas typically it might be 5 millimeters. That smaller margin means less healthy tissue gets irradiated unnecessarily.
Okay, so better tech leads to potentially even fewer side effects within this already promising approach.
That seems to be the suggestion from this data, yes. More precise aiming, less collateral damage, so to speak.
So let's talk implications then. If this holds up, it seems pretty huge.
I think so. The most obvious implication is dramatically reducing the treatment burden for patients.
Going from, say, 6 weeks of daily visits down to just 5 visits total. That's life-changing for someone trying to work, manage family, just live their life.
Absolutely. It gives people back so much time and significantly lessens the disruption.
Could it also mean more men actually get the radiation they need after surgery?
That's a strong possibility, and one the researchers highlighted. That huge time commitment of conventional radiation is a known barrier. Some men might decline or delay treatment because of it.
Right. But if it's only 5 sessions...
It might remove that major hurdle for many, potentially leading to more men receiving this therapy that could, reduce their risk of cancer recurrence.
Makes sense. Are there other potential benefits, maybe cost?
Definitely potential for cost savings. Fewer treatment sessions generally means lower healthcare costs, less machine time, less staff time, fewer patient visits.
Okay.
And the researchers also floated the idea, though it needs more study, that there might even be some biological advantages to delivering radiation this way. These high-dose SBRT fractions might interact with the cancer cells differently. But that's more speculative at this stage.
Still, convenience, potentially wider adoption, cost savings. It all sounds very positive. But we need to be balanced. What are the caveats, the limitations of this SCIMITAR trial?
Very important point. The biggest one is that it was non-randomized.
Meaning the patients weren't randomly assigned to get either SBRT or conventional treatment.
Correct. The SBRT group chose SBRT, or were offered it, and the comparison group was historical. This means there could be underlying differences between the groups. Maybe the SBRT patients were slightly younger or healthier or had different types of surgery factors other than the radiation type that could influence the outcomes.
So it can't be 100% sure the only difference driving the results was the type of radiation.
Exactly. That's a key limitation of non-randomized studies. Also, the follow-up time.
Just over 2 years, you said?
Yes. And while that's enough to get a good handle on immediate and short-term side effects and quality of life,
it's maybe not long enough to be certain about long-term cancer control.
Precisely. Preventing cancer recurrence is the ultimate goal, and that often requires follow-up over 5, 10 years, or even longer. 2 years gives us early data on safety, but not the final word on effectiveness compared to the standard treatment.
So more research is needed on that front.
Definitely. And it's happening. The SCIMITAR team plans to release updated data specifically looking at cancer control rates. And perhaps more importantly, there's a larger randomized trial underway led by UCLA called Excalibur. That one is randomly assigning patients and should provide more definitive answers on both long-term safety and cancer control.
Excalibur. Good to know that's ongoing. What about other experts? What's the buzz around these findings?
Well, Dr. Amar Kishan, who led the SCIMITAR study, is obviously quite positive. He was quoted saying this approach could remove a major barrier to post-surgery radiation.
He mentioned the convenience, cost, and that potential biological edge.
Yes, exactly. And he highlighted that his institution, UCLA, has a lot of experience with SBRT before surgery, and this trial provides key evidence for using it after surgery.
Any other perspectives?
Dr. Michael Steinberg, another author on the paper, expressed optimism too. He basically said that shorter, more convenient schedules are the way forward for improving care and quality of life, and called this study a crucial step towards making treatment more accessible.
So, general enthusiasm from those involved, acknowledging the need for more data.
That seems fair. And the conclusion in the actual JAMA Oncology paper was quite measured. They stated that post-surgery SBRT was well-tolerated and, importantly, didn't lead to a measurably worse decline in urinary or bowel function reported by patients over 2 years compared to conventional radiation.
Okay, so if we were to boil this all down for someone listening, what's the main message they should take away from this deep dive?
I'd say the key takeaway is this. We have promising early evidence suggesting that this much shorter 5-session course of high-dose radiation SBRT seems to be as safe as the standard weeks-long treatment when it comes to short-term side effects and impact on quality of life after prostate surgery.
Huge potential for patient convenience.
Massive potential, yes. But, and this is the crucial but.
It's still early days in terms of proving long-term effectiveness.
Exactly. We absolutely need the results from longer follow-up and especially from those larger randomized trials like Excalibur to be really confident that it controls the cancer just as well over the long haul.
So definitely something to watch. It's exciting, but with appropriate scientific caution.
Well put. Promising, but needs confirmation.
It really makes you think, though, if we can find ways to deliver treatments like this shorter, potentially just as effective, maybe even with fewer side effects thanks to better tech. What could that mean?
Yeah.
Well, what could the widespread adoption of therapies like this mean for patients' lives, obviously, but also for, healthcare systems, how we use resources, how accessible top-tier cancer care becomes for everyone? It's a pretty powerful thought for the future.
It certainly is. Lots to think about as this research continues to unfold.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.